Now I'm in conversation with Chris Jones, who's based in the USA. I'm going to ask him to tell him about himself and also the company that he works for, and also any involvement in COVID-19 related issues. So, Chris, where are you talking from at the moment?
So yes, I'm talking from sheltering in place here in Burlington, Vermont. And I am
Okay.
the founder and CEO of Trustr, which is a telehealth solution that seamlessly connects wearables to asynchronous information and conversational chatbots, uses conversational chatbots to reach patients in their own words and then to understand empathically what's going on in their lives and care journeys.
Okay, so what's your background? How long have you been involved in healthcare?
Yeah, so I've been in the space of healthcare, really telehealth or mobile health or e-health, and behavioral economics for the last 20, 25 years.
Okay, you don't look old enough, if you don't mind me saying so.
Thank you. That's right.
You haven't aged in the same way that I have. But
Well,
anyway,
we were drinking the same Kool-Aid, David. I got my PhD in behavioral and health economics at Oxford University, my master's in biology from the same place, and then I trained as a biologist at the University of Michigan, Ann Arbor.
okay. So how did you get involved in telehealth then? What attracted
Yeah.
you to that?
So my first involvement there was when I was working as a very junior health economist staff member at NICE, National Institute for Health and Clinical Excellence. And there I was responsible for putting together health economic guidance, especially for returning soldiers who are faced with post-traumatic stress disorder and a number of other disorders, including drugs misuse and so on. And what we found was that we knew that these solutions were kind of ahead of their time, but also because of the way computing power had not yet fully evolved, they were also a little bit too far ahead of their time. So I got to see firsthand what solutions were coming around the corner, and then focused on patient-based research at Johns Hopkins University for my postdoc training, and then went into business, where I've been ever since.
Okay, so you're running your own company. What kind of wearables are you using in your practice?
At the moment, we speak with up to 50 wearables, so pretty much anything that you can imagine, whether it's Google Fit, HealthKit, Fitbit, and the like. And we can API to really any medical device. We could talk to your heart if you had a mechanical heart or a sensor-enabled heart. We could talk to your home if that were sensor-enabled, or your car, or your loved ones, in the case of dementia, for example. So we feel that we just offer reach that is distinct among a very crowded space. And that reach is accomplished in the simplest scenario because we can talk in native text, so real text, meaning just a phone number talking to you. We can also talk through WhatsApp and all sorts of other different everything solutions.
So, in simple terms, how does the application work? So the wearable is collecting the data, going to a mobile app, and it's communicating with the user. What connections has it got with the clinical practitioners?
Sure. So we're assembling a validated database of clinically meaningful chats, and those would come from clinicians who have 55 years of experience practicing medicine. And those empathic chats, we feel, can occur asynchronously, meaning any time of the day or night, and be very meaningful to patients. So they receive essentially a meaningful conversation with a physician without having to interface with that physician directly. And then depending on their needs, their conversations can escalate to a live chat. We can co-register with those wearables as mentioned. That doesn't have to happen. And we can also offer intermittent rewards, which we found through behavioral economics and so on, are the most effective means of driving patient engagement.
So you're using gamification techniques basically to.
It is, but in a non-creepy way, David. So it's really in a way that surprises you, and you're like, great, you received it. Congratulations, David. Did you realize that you've been extra careful at taking your medicines this time of the day or week as compared to last week? And here's why you're part of the 5%, who are taking this seriously. and why you've just reduced your chances of transmission for COVID-19 by Y%. And based on your geolocation that you've given us permission to explore, we also wanted to say that you've done a fantastic job resting in place. And here's a $5 gift card to Starbucks, Amazon, or what have you.
Oh, okay. Yep, I understand. And so when it comes to a clinical approval, is this a medical grade application that you get FDA approval for?
Yeah, so we're prepared for that. We're prepared for something called Meaningful Use 3, which in the US will give patients the right to their electronic medical record as a legislative mandate. And we can supply that connectivity in a super secure manner that is both GDR compliant as well as California compliant, and so on, the right to be forgotten. However, right now, we're not focused on that. We don't want to be providing life or death information to people. We want to be providing an encouraging tool that will allow them over this long haul to do the right things, to have access to appropriate information, and most importantly, to share their experiences in their own words.
Okay, I understand. Well, what you've just spoken to me about is very relevant for the last discussion session, which is really about some of the impacts of COVID-19 on mental health and psychology. So I think that will make quite a valuable contribution to that part of the panel discussion.
Thank you. I'd like to add one more thing, if I may.
Sure.
That is even more broad than Trustr. And all of you can go to trustr.us to see what we're up to. We've got demos there and so on, trustr.us. But the thing I'd like to mention, the circumstance is that because elective surgeries are almost entirely canceled, this means that people in pain are resorting to opiates and other drug palliative care, which is extremely dangerous in the opiate epidemic. Secondly, those who are admitted to the hospital and have to be intubated are on fentanyl. So I feel like the next waves following this crisis are going to be treating drugs misuse, as we've done before, and handling with all the cyber crimes now that people are working from home and resorting to saving things on their own computers and talking through telephony as opposed to secure lines. So I just wanted to flag that in this broader telehealth context. Security is very important.
Absolutely. I think I'll probably also introduce you to a colleague of mine, works for a company called Fast Future. He's a CEO of a company called Fast Future, and he's about to publish a book on the impact of COVID-19 and what comes next. And these are the kind of issues that I think we have to be prepared for. So
we're expecting a privacy Pearl Harbor, if you will.
Yes, absolutely. Yes. So thank you very much for giving your time to chat to me now. So
thank you for yours. Thank you for listening.
I look forward to seeing you at the event tomorrow afternoon. And thank you once again.